Hello everyone, this is Dr. Siddharth Acharya and I am going to discuss my MRCP Part 1 and Part 2 preparation strategy. I gave my Part 1 this year in April 2024. I took 3 months for the preparation. After result of MRCP Part 1, I again took 3 months to prepare for MRCP Part 2. So in a span of 6 months, I managed to clear both Part 1 and Part 2 in the very first attempt. So let me share my strategy. And so there are these three questions that you might be asking, that what is the right time for the preparation? So for me, what I thought, that for me the right time was second year. Now, why second year of your residency? I am currently pursuing internal medicine and I am a third year resident right now. But during my when I decided to give part 1 exam, I was a second year resident. So this is the very, I would say, a very good time for internal medicine residents to give this exam, because see, in your first year everything is new to you. There are multiple things you are getting accustomed to, and everything is new. Your entire residency life is new. So it takes a lot of time to learn the stuff, to then take out some time for yourself and then prepare. So it is a huge thing to start preparing from first year. If you can do, it's good. But in second year there is certain advantage where you are accustomed to all the works you have done. You are slightly on a comfortable zone. And another thing that you might utilize is your posting of district residency program for 3 months, which is usually not that hectic as your usual residency. So all these points taken together, second year of your residency is the best time for preparation. However, many candidates do give the exam just after the NEET PG preparation, or just after the NEET PG exam is done, because part 1 there are multiple subjects which you can tackle with your NEET PG preparation also. And many people also attempt after passing MD exam, then this MRC part 1 and part 2 becomes very easy. But however, I chose second year of my residency to give it, and that was my decision. So what was the time required for the preparation, and what is the adequate time, which you might ask? So for me it was 3 months for each diet. So 3 months for each diet is, for me it was an adequate preparation. Because, and what is the reason, if I retrospect, that why was I able to crack the exams within a span of 3 months, is that I was doing my residency, I was learning things, I was doing the practical things in the wards, I was reading books. So the knowledge of MRCP exams that is being tested, that I am practicing on a daily basis. That is the edge to internal medicine residents. While they are practicing, while they are doing their residency, it is sort of, it becomes the reflex. You are using the drugs, you are treating the patients, and you are seeing everything and everything at the bedside. So, and they are testing, the MRCP exam tests your clinical knowledge, your practical knowledge a lot. So 3 months of full focused preparation was my strategy. Actually, I did not get much time. And for that you need to concise your resource, which brings me to the third question, that what are the resources that are required. So if you do your residency properly, if you are reading your books after you come home, whatever time you have, let's say you are reading some part of Harrison or Washington manual, it is on a daily basis you are doing. So just deciding that I am going to give this diet after, let's say, 4 months or 3 months after, you stick to one concise resource. You don't need to read too many books, because you are already doing internal medicine residency. So many things you are doing on a daily basis. For exam oriented learning and only just a concise preparation, for me it was past test app. And this is not a promotional video. I just researched about the various apps and sources on the net, and I took past test. For me it worked. I just did the MCQs, just did the Q bank, and gave the mock tests, and did not do any other Q banks like past medicine or BMJ. I did not have that experience. I just did past test. I just did past test. So so let me show you my part 2 before I gave my part 2 exam, my final progress in the past test app. And of course, another thing I used that apart from the past test app was this book by Philip Scalra, that is also from past test. But again, I could not, to be very honest, I could not finish this book entirely. But if you have time, definitely you can do it. Before giving my part 1 exam, I could finish somewhat 72% of my Q bank, and that was sufficient for me to pass the exam in the very first attempt. Just before the part 2 exam, I could finish again close to 72% of 83% of the entire Q bank, and this was my score, that is 72% overall. I did the Q bank religiously, whatever I did, whatever time I got during my residency, and this is the progress of, this is all about part 2. I do not have the screenshots of part 1, and these were my final progress. And see, I have started at June, my exam was at September. I started from somewhere close to 60%, and it went up to somewhere to 72%. So this was my final progress just before the day of my exam. And yes, I also gave some Q banks, past papers, and the 77% was the average. And these are all of my part 2 details. So all in all, for me, what it worked, and you might also give it a thought, try to attempt this exam in the second year of residency, number 1, and take full 3 to 4 months for preparation, and stick to only single resource, be it past test or any other Q bank which you use, which you feel comfortable for you, be it past medicine or BMJ, whatever it is. Just stick to a single resource and do it religiously. Don't jump from question bank to question bank, from this app to that app, because you don't have much time during your residency. You have to be very focused and practice a conceptual learning, because they test your clinical knowledge and practical sense a lot. So we will discuss more about the strategies in the coming videos, but this was in a nutshell. So yeah, that was all. So thank you. Keep studying.